disease, not.
It cannot be. So men, you better know now that you're included. You can have it as well. Therefore, regular screening is equally important to you as a man. You get to the hospital and try to know from your physician how you can get screened to know whether you have breast cancer. You know, the one that the men would naturally want to take a look at mostly is prostate cancer.
Yes. Yes.
But breast cancer, you can have it to better know now. Well, if you have just joined us, the program is Health Hour on Rama Television. And when we come back after this break, we would continue with the program. Please stay with us. Welcome back. The program is still Health Hour on Rama Television. World Cancer Day is marked on the 4th of February every year. To that extent, quite a number of activities have been set aside to mark the day by this particular organization, Save a Life Cancer Awareness and Support Network. Now, Dr. Maria, could you please take us through what activities you have lined up to mark the World Cancer Day?
So, as you mentioned, every year 4th of February is set aside as World Cancer Day, and the importance of the day is to create awareness and to exchange ideas about all the types of cancer. So, but in our organization, Save a Life Cancer Awareness and Support Network, Salkasun, we have our own activities lined up in celebration of that day. So normally what happens is every year the UICC sets a theme for the World Cancer Day, and it usually runs for at least 2 years, I think. Yeah, so the last theme was I Am and I Will. Like, I am Mariam Nasser and I will advocate for cancer care or cancer support or something like that. But then this year, the theme is Close the Care Gap. Especially in our environment, there's a lot of gap in terms of care. The hospitals or facilities that provide cancer care are not enough, the personnel are not enough, equipment are not enough. So what can we do to help close that gap? So in Salkasun, what we decided to do is on that day, World Cancer Day is on 4th, but we are all working class women and men. So we set aside Saturday where we are going to meet at Mina Event Center in the morning, very early in the morning, and we are going to do a cancer walk.
Mina Event Center,
yes.
Yeah,
Lodge Road, yes. So we are going to first of all kick off with a walk. We're going to do aerobics and then take off from Mina to Government House roundabout and then go to Tarauni and then come back to Mina. So while we are walking, you know, it will attract attention. Sure. It will be quite unusual for people to come out in various colors, you know, and chanting slogans, you know, slogans of hope, slogans of awareness and survivors and all that. So in the process, we're raising awareness because people will ask, what are these people doing? Okay, we are raising awareness on cancer, you know. And then we come back to Mina where we have a panel of experts various experts in various fields, especially general surgery and gynecology, where we're going to discuss breast cancer extensively and cervical cancer. And we made it in such a way that we have survivors of the cancers so that they will share their own experience. So the survivors are part of the panel.
Okay.
And then questions will be asked. You know, there will be interactions between the experts and people and then the survivors. And then we'll have a health talk concerning other aspects, not just cancer, other aspects of health. And then the most important thing is, in our own way to close the care gap, is to do the screening. So we intend to do a free health screening for diabetes, for hypertension. And what is peculiar about our own type of screening for diabetes, for example, is it doesn't just measure your glucose level for that time. It goes back in time, like giving a picture of what has been happening over months.
Okay, history.
Yes.
Okay.
Yes, so we do that, and then that's general for both men and women. And then we do the breast screening, where we are going to use very innovative new equipment known as the breast light. We're going to shine and see if there is any suspicious lesion around the breast. And then we're going to subject the women to breast ultrasound scan as a screening method as well. And then we have gynecologists who are supported by M1, Medical Women Association of Nigeria. And then we'll screen for cervical cancer right then and there. The result will be out. So just in case we happen to detect cases, because it's not unusual for you not to detect cases. Like last year we had at least 3 for breast cancer. I'm not sure of the cervical cancer, but we detected at least 3 for breast cancer. So just in case we have those women, we have partnerships with Aminu Kano Teaching Hospital, so we make referrals and then we refer them, and then they get proper evaluation and get diagnosis and then the staging, and then we start the treatment. And then still, just in case that they are not financially buoyant to take care of the cancer costs, so we as an organization, we come in, we have this program, Adopt a Cancer Patient, where we completely adopt the patient in terms of care and even rehabilitation at the end of treatment. And then final activity for that day is to launch our Cancer Support Trust Fund. Last year, we established, in collaboration with Community Health Research Initiative, which is another non-governmental organization. We partnered to launch a trust fund, which is the first ever in Kano. So in that trust fund, we are soliciting for donations, you know, from individuals.
Dr. Mariam, I'll come back to you.
Okay.
I want to meet the founder of Sarkasun.
Yes.
Yes. Save a Life Cancer Awareness and Support Network. You know, in the process of sharing your experience with us as regards breast cancer, you mentioned the fact that it's very expensive.
Yes, it is.
And now you have this NGO, this organization. How do you raise funds, knowing how things are difficult in the country today, and knowing that it is very expensive to take care of one who has breast cancer or cancer, and then we have less facilities to take care of that? I know there is a center in Abuja. You know, that's Cancer Center in Abuja, for instance. I don't think we have many of them in Nigeria.
Yes.
So this is a very, very gigantic project. How do you raise funds? How do you get your money to be able to do all of this?
Okay, before the establishing of this trust fund, we raised money between us members of the organization.
Oh, within you?
Yes. Not because we didn't seek for donations outside or internationally. It's that we've not yet gotten those donations.
Okay.
So we try to do what we can in our own little way. Like the lady we adopted, the lady Dr. Man was talking about, we adopted her. She was an orphan. She had nowhere to turn to. She was living with her grandmom. They could barely feed. So we adopted her and we sponsored her treatment to a certain stage. Just like you said, the cancer centers in Nigeria are few. Compared to the population of over 200 million, we have just less than 10 cancer centers in Nigeria that are government owned. And even the private hospitals, I don't think we even have a private hospital that has a radiation machine in the north.
No.
We don't. The closest is in Abuja.
Yes.
Then down south and east, that's where you get them. So you can imagine. And the north, in population, I think we are fast catching up with Lagos, Kano State.
Sure.
We are fast catching up. And the closest you can get to is Zaria, Shika. Or you go to Sokoto.
So we don't have one in...
No, we are yet to have one.
Not yet.
We do not have anyone in Kano. And Kano is the most populated state in the north.
Yeah,
I'm very sure of that.
No, you're right.
Yes.
So we need not one, not two, not three machines in Kano. You understand? And when you go to all these other states, the waiting lists, when I was told that, okay, I need to do radiation, I now went to Shika. I was given an appointment for 6 months to come back because of the people that were waiting. So you can imagine if I had waited another 6 months. So that itself is a risk. Even if you have the money in Nigeria, you are still at risk because there is no facility.
Yeah, the facility.
So that is why we should emphasize on early screening. I am still back on early screening. Once it is screened early, a lot of issues are being solved. So as Dr. Mariam said, we intend to raise funds on that day for the Cancer Trust Fund. So
Which
that,
day is that? Which day?
On the 5th of February, Saturday, this Saturday, next tomorrow.
Okay.
Yes, at Mina Event Center, Lodge Road, we intend to raise funds for this Cancer Trust Fund so that we will be able to be buoyant enough at least to help those in need. And since we launched the Support Trust Fund in February last year, so we only had a press conference. So let's even see, people are not even aware that we have such trust fund. So thank you for... Yes.
That you're expected to let people know that you need their support.
Yes.
True.
Their financial support in order to be able to have money to run this organization, to help those who are facing this cancer problem. You have an opportunity right now to let the public know that you can make payment to this particular kind of account or that, like maybe it's Zenith Bank.
Yes.
Maybe it's Sky Bank. Earlier on, I tried to get information regarding that. You said Zenith Bank.
Yes.
With the account number.
Yes.
121-056-4078. And the account. And so now you have heard this. You have heard experience from someone who has gone. It's dangerous, we know. But if you can detect it early, you will survive. You have no problems. You will come and give testimonies just the way Hawa is doing right now in the studio on the program Health Hour. So you can support this trust fund by making payment. No amount is too small, no amount is too big. You're helping to save a soul, to save a life when you do that. Because if you see what those who are facing this cancer challenge are going through, you will not wish your enemy to go through it.
Absolutely.
Therefore, it is important that as they have an account number here, make payment into it. It could be your own brother, your sister, your relation, your father, your mother, your wife that is affected. Now, if fund is raised from this, they can pull something out to support you. So the account details again: Zenith Bank 121 056 4078. The account name is Cancer Support Trust Fund. So it is open to everyone. There's only like, maybe it's only the government or only individuals or organizations. Now, as we get set to wind up this edition of the program, Dr. Mariam, tell us treatment and prevention of cancer.
Okay. So I mentioned about risk factors for cancer. So it depends on the type of cancer, but generally the risk factors are the same.
Okay.
You know, but there are some specific risk factors for certain cancers. I think I mentioned human papilloma virus and its relationship to cervical cancer, and it can even cause some other types of cancers like cancer of the mouth and the throat. So like hepatitis, it can cause liver cancer. So those are risk factors that are classified as modifiable risk factors. They are risk factors that you can do something about them. These being infections, unfortunately, there are vaccines for them. Even from childhood, you know, from infancy, you start hepatitis vaccine. Now, what we're advocating now is for the human papilloma virus to be included in the National Program for Immunization, you know, so that young girls and boys can start the vaccine early. So it's advocated for girls and boys between the ages of 9 and 16 because before they become sexually active, because the virus is sexually transmitted. So before they become sexually active, they are expected to have 2 doses of the vaccine, and then they are protected from having cervical cancer. So and other modifiable risk factors include maintaining a healthy weight. You know, obesity has been linked to about 13 types of cancers, not just breast cancer or cervical cancer. It has been linked to oral cancers, cancers of the intestines and all that. So maintaining a healthy weight within the normal range is actually very important, and it's something that you can do without much resources by being very physically active and involving in exercise, and as much as possible limiting our use of cars. You know, elsewhere walks are included in normal routine, in normal walk, but here is everybody will drive a car to a certain point, you know, and all that. So, and another thing very important is eating right, a healthy diet rich in vegetables and fruits, highly protective, and low sugar, low refined sugars, and complex carbohydrates. Very, very important to limit them. And as well as, you know, highly processed foods and foods with additives and preservatives.
Okay, that's how we come to the end of this edition of the program, Health Hour on Rama Television. And I have been with Dr. Mariam Nasir, Yusuf Maitama Sule University, Kano, Head of Anatomy Department, Head of Medical Operations, and Chair of Organizing Committee of Save Alive Cancer Awareness and Support Network. Thank you, Doctor.
Thank you very much.
As well as Hawa Adamu Kakudi, founder of Save Alive Cancer Awareness and Support Network. Thank you so much, Auntie.
Thank you.
Try as much as possible to stay healthy always. And so, until we meet again, my name is Joe Ohwe. Bye-bye.